for our health care, I wouldn't be standing here to tell you that. And it's like, it's important that Senator Flake knows that this is the wrong thing for America, and what he's supposed to do is do what's called substantive law, take what's best for everyone, and not stand there and tell us, well, I agree to disagree. If he represents me, he better agree with me, or he's not representing me. Thank you.
I'd like everybody to, I got a little tablet here, we should put our names
And zip code.
addresses.
Or address, yeah.
Address on it, so that he knows that we are.
Serious.
I'd like I can tell you also that my healthcare, I literally almost died last October. My potassium fell to 1.8, and I lost the ability to move my arms and legs. And I went in what's called rhabdo. I was in the hospital for a week, and here I stand today, 61 pounds lighter, completely healthy. And I'm broke. I mean, I'm literally have no money. So were it not for the healthcare that I have, I would be dead. And this scares the crap out of me. It saved my life, and I don't know where I'd be without it. Thanks for listening.
So, my brother actually, right now, he is a healthy, contributing member of society due to the fact that he was able to get care for a drug addiction that he had under the Affordable Care Act. He was working and he was rear-ended by a truck, and then he had to have like an operation on his back. And the doctor prescribed him very, very strong pain pills that he ended up getting addicted to. And he has children. It destroyed my family almost, his own family. He's like so he was able to get help through the Affordable Care Act. If it weren't for that provision in the Affordable Care Act, I don't know, he could be dead and his kids would be without a father, and I'd be without a brother. My parents would be without a son. Because until then, we weren't able to get him help. There was a while when he was willing and wanting to get help, but we weren't able to until the Affordable Care Act came along, and we could afford that because I don't know if you know, but that type of care is extremely expensive. That's one of the things that is on the chopping block. My brother would probably be dead now. And I think, and like I said, now he's like 2.5 years sober and great and doing wonderful and better than ever. And we have Obama and we have the Affordable Care Act to thank for that. And I just want, look, I believe that Senator Flake is a good person. I do. I don't agree with him politically, but I do believe he's a good person. I believe that he's in a difficult spot. And I know, unfortunately, that he does take money from the health insurance industry. But he's not alone in that. But it's just that this right now is a very critical, crucial time when we need people like Senator Flake, who are good people, who do care about the people in their states, who do care about the people in their countries, to stand up and do the right thing and save some lives here. Because the Affordable Care Act is not perfect, but there are things that can be done to improve it, and that doesn't include a big tax giveaway, to the wealthy, and just chopping out vital programs that have saved lives. We can do better than that. And so that's kind of, we're here to really beg for that right now, because right now we're very scared. We know that under Mitch McConnell's leadership, this is not Senator Flake, but under Mitch McConnell's leadership, the Republicans are kind of crafting something that's completely secret, and there's a reason for that. Obviously, they don't have any confidence in it because clearly it's not good for the American people. So this is a perfect opportunity for Senator Flake to stand up and just do what's right, and I think he'll be richly rewarded for it. I think so many people will be very happy, and I don't think he'll be alone in that. So we just want to really urge him to do that for Arizonans. Thank you.
Thank you.
Brother's
okay.
Thank you very much.
I'd also like to leave a message. I know this is a small group, but we're sitting on a Friday afternoon in 110-degree weather. But this group can grow, and we're here committed, I think, because we don't want to see that, but there's no reason that we wouldn't escalate also. We're here as constituents of Senator Flake, and his job is to represent us, and so we're here to tell him how we feel and what we want him to do. So this is absolutely the time for him to take leadership and do his job and show that he's here for his Arizona constituents that not only want to keep the ACA, but a lot of us are here to advocate for healthcare for all. People are tired, and more people are learning that our congressional senators are putting profits time and time again before lives, before what healthcare really should be.
Here, here.
And we can let more and more people know, and either he can play this game right and do his job right, or he can continue to accept healthcare industry money if that's more important to him. But we're here because we actually do care about everyday people and lives.
And we're also here as the voice for people who can't be here.
Exactly.
So we
Exactly,
heard
yeah.
from a lot
And
of-
if I could
lots
add
of
something
people
as
here.
well, just about the addiction issue. I work with children who are in foster care. I've been doing this for 15 years. Since the ACA was enacted, there is actually treatment available for parents with addiction problems, which I would say 95% of the cases are addiction related. I've seen families, because they've been able to get treatment and get well and get sober, I've seen families get back together. Since ACA, which I didn't see that before because there wasn't anything available for these parents. Now, there's, at latest count, some 18,000 children in Arizona foster care. And we raise them, especially the teenagers, in group homes with a lousy, lousy outcome. Most of them end up in prison. So if we don't want that to be the way, we won't do anything that will interrupt the treatment that these parents can get and the ability to reunite these families. And the other thing I would just like to add to that is also, I'm actually a registered Republican, but I'm here doing this because I see what is happening to the Republican Party, and it's outrageous. And then trying to pass this bill behind closed doors with no committee meetings, no review, no nothing, that's just outrageous. Any American, regardless of your party affiliation, should be outraged at the process.
And I'm glad you stated that, because something we haven't talked about is that this is a bipartisan issue. It's a no-party issue because we all have healthcare problems, and when profits are prioritized, kids shouldn't be losing their houses because their parent got cancer, and vice versa. Parents shouldn't be losing their houses because their child got cancer, and these are things that we cannot control. So this shouldn't be about controlling the market and maximizing profits. It should be about maximizing livelihood, and not just saving lives, but quality of life. People can go in for a hip surgery and they're not covered for physical therapy. I'm in that boat of people. So I mean, this goes every which way. For as long as you're human, you're at risk of having healthcare issues. So this isn't a partisan issue, and I'm really happy to see, and he should bear witness that, there are Democrats, Independents, and Republicans that are asking him to not repeal the ACA.
And bring out this process into the light of day.
Yes. And I would also like to add that troubles don't just begin if something happens to the ACA. Just the fact that this is being done in such secrecy and people's lives legitimately actually hang in the balance. It's starting to become increasingly aware that unless you're really rich in this country, you are screwed. And so this pain and this suffering and this anxiety is happening now. Now. It's not just it might happen, it's happening now because of the way that Mitch McConnell is basically running things, and that's not right. People
So
are
have you
suffering
got all
right
that?
now.
It's not a totalitarian government.
I'd like to speak too. I'm not as good of a speaker as everyone else, but I'd like to read the letter that I brought into Flake. I attended your recent town hall that you held in April. I didn't agree with most of your positions on the issues that concern me, but you did not shy away from difficult questions and in fact let the town hall run longer than originally scheduled to take as many questions as possible. For that, I gained a great deal of respect for you. Thank you. I appreciate your willingness to listen and engage with your constituents. In light of the attack earlier this week, I want to express my relief that you were unharmed. I do not and will never condone violence. I wish no harm upon anyone and surely wish no harm upon you. So please know that my thoughts are with you and your family. and I hope that this incident has helped you better understand what so many Americans feel and experience each day. I am not anti-gun, but I hope you will reconsider your stance on the Second Amendment and push for common sense gun control. Despite the tense political climate we've been living in, our humanity and ability to feel empathy for our neighbors should be the basis by which we move our country forward. Nobody should have to live in fear for themselves or for their loved ones. No matter where you are on the political spectrum, we all want safety and security. So with that same focus on protecting ourselves and those we love, that's why I'm here today. I ask that you oppose the AHCA and vote no. I worked as a medical claims analyst for 5 years in the limited benefits division of Cigna Healthcare, prior to and after the passage of the ACA, and the majority of my time was spent denying claims. The plans I administered did not cover pre-existing conditions, preventative care, and many essential health services. Passage of the AHCA will not only move us backwards and return us to a time of junk plans, but it will be even worse than before for millions of Americans. I know firsthand what this bill will do to the most vulnerable people among us, both from my professional experience and from my personal experience. I have 3 boys. 2 are covered under access, which is threatened by the deep cuts to Medicaid included in this bill, and 1 who is fortunately covered under his father's insurance policy. The majority of Medicaid recipients are children, and my youngest son that is covered under his father's plan is autistic, a walking pre-existing condition. If Medicaid is defunded, pre-existing condition exclusions are re-implemented, and if his father lost his job, we would be left without options. As I am currently uninsured, my employer does not offer health insurance. I work full-time, and I cannot afford a private plan. So in the future, my family would be left without coverage. Also, in my younger years, I regularly received care from Planned Parenthood clinics that would be defunded by this bill, that for some women and men is the only place they can receive care. As a woman, this bill would make me a walking pre-existing condition. I worry about my boys, and I also worry about what kind of world I will leave them in if something were to happen to me. If I get sick, for example, breast cancer, that would be considered pre-existing condition, and my only option would be to die in the streets. I always ask myself, will my family be able to survive without me? These are not questions that anyone should have to consider living in the richest country on earth.
Yes.
We cannot move back in time simply for the sake of winning and scoring points for the wealthiest among us that do not need to be further enriched. Please show courage and stand up to this administration, as I do not believe that this is the future that you want for your fellow Americans.
Thank you.
Thank you.
Can you hand that to him?
He's got a copy.
And just to underscore that our sympathies are with him and we don't condone violence.
It was beautiful. Thank you for your time.
These are the names.